Distinguished ladies and gentlemen, may I call on Dr. Ijeoma Okoli, Department of Hospital Services, who is representing the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako. Ma, the ministry is welcome to present a goodwill message to this program. Please, a round of applause for her as she come up stage. Thank you, ma.
The representative of the Honorable Minister of Arts, Culture, Tourism and Creative Economy, the representative of the Chief of Defense Staff, representative of Commander, Nigeria Army Medical Corps, the representative of the coordinator, NYSC, FCT, our royal father here present, medical and wellness tourism stakeholders from within and outside the country, conveners of this program, members of the press, distinguished ladies and gentlemen. I bring you warm greetings from the Honorable Minister of State for Health, who would have loved to be at this program, but is unavoidably absent. So I will read his keynote address. It gives me great pleasure to join you today at this third edition of the All Africa Medical Wellness Expo. I extend my gratitude to the organizers for this remarkable platform where ideas are exchanged, partnerships forged, and innovations that place Africa on the global map showcased. This year's theme, Medical and Wellness Tourism, Bridging Global Health Gaps, is both timely and visionary. It invites us to reimagine health, not only as a service delivered within our borders, but also as a powerful driver of cross-border collaboration, economic growth, and human well-being. Medical and wellness tourism, as we all know, it's been said by the speakers that have been here, that it refers to people traveling across countries and across regions to access healthcare services. And these range from surgeries, specialist treatment, to spa therapies, preventive medicine, nutrition, and even lifestyle enhancement. And so here, we're not only talking about outbound tourism, we're also talking about even the tourism that happens within Nigeria, within countries. So reasons for outbound medical tourism, which is predominant in Nigeria, includes lack of trust in healthcare services, poor skills and infrastructure, long waiting lists, and in a lot of other parts of the world, high treatment costs also leads to medical tourism. And globally, this sector is expanding at an unprecedented pace. The medical tourism market is estimated to surpass 180 billion by 2026, with wellness tourism valued at over $800 billion annually. Countries have leveraged on this opportunity, combining high quality with competitive pricing and unique cultural experiences. Africa, as we all know, is home to about 18% of the world's population. And this percentage is significant, as it is the second most populous continent in the world. It accounts for, despite being the second most populous continent, it accounts for less than 2% of global health expenditure and only 3% of the world's healthcare workforce, despite a huge burden of disease. These statistics reflect structural inequalities that have persisted for decades. But within these lies opportunities. Africa has the youngest population in the world. It has immense human capital, a growing digital economy, an abundance of indigenous knowledge, which we can exploit. Nigeria loses over $1 billion annually to medical tourism. An average of 9,000 medical tours occur monthly from Nigeria to other countries. You can imagine what $1 billion can do if people are bringing this into Nigeria rather than taking that money out. So, like I mentioned, reason why we go outside is because we're looking for high quality of care. We're looking for experts that use current innovations in medicine, availability of adequate information and marketing of services, too, is one of the reasons why Nigerians travel out. And sadly, we travel for even things that we do in the country. We travel sometimes for as little as medical checkups, which is done in virtually all Nigerian hospitals. So the phrase bridging global health gaps speaks to reducing inequalities in access, affordability, and outcomes. Medical and wellness tourism contributes to this by providing access to care beyond borders. It allows patients to seek medical help in areas where they can afford. Services may be scarce at home, and so thereby promoting global equity. Investment in local health systems is one of the things we're talking about here, because medical tourism strengthens hospitals, training institutions, and infrastructure, and ends up benefiting the local populations. There is also knowledge transfer, international collaboration through tourism, sharing expertise, best practices, and innovation. By attracting wellness travelers, we elevate the culture of preventive health, fitness, nutrition, and mental balance, areas which are often neglected in traditional healthcare. Beyond healthcare, there's also medical tourism also stimulates hospitality, transport, ICT, and the broader economy. In this way, tourism does not just move people across borders. It moves knowledge, it moves resources, it moves opportunity, and it creates bridges between regions and nations. In Nigeria, the federal government is deeply committed to reforming our health sector into one that not only meets domestic needs, but also attracts international clients. Too often, our narrative has been defined by medical tourism abroad, with Nigerians traveling overseas in search of medical services. Now is the time to reverse this tide, and that is why I say that this conference is timely. Through the renewed hope agenda of Mr. President, the Federal Ministry of Health is taking bold steps to bridge medical tourism gaps. We're improving governance by enhancing leadership, transparency, coordination, and accountability across all levels of healthcare system, because we want to hold the healthcare system and the people that practice in it accountable. I think that is very key. We're also investing in infrastructure, modernizing facilities, and improving equipment, while also focusing on retaining and attracting healthcare professionals through better remuneration and working conditions. Specialized services are springing up across cardiology, oncology, nephrology, orthopedics, among others, that are being developed and upgraded. You will recall that the federal government recently commissioned world-class cancer centers in Benin, in Katsina, and Enugu, and there are also plans to still do this in other parts of Nigeria. These centers are expected to serve over 2,000 cancer patients annually, while delivering diagnostic services to more than 450,000 Nigerians across the country. Guidelines for organ transplants have been developed to ensure patient safety and ensure ethical practices. The National Health Insurance Authority is being expanded to achieve universal health coverage, thus looking for so that financial barriers no longer prevent families from accessing care, thus looking for cheaper countries for procedures. Primary healthcare centers are being revitalized to ensure essential services to communities. Workforce gaps are being tackled by scaling up training and retention of healthcare professionals while leveraging technology for task shifting and telemedicine. We are unlocking healthcare value chains by promoting production of medicines, medical supplies, and equipment to reduce dependency on imports and boost the health economy. Again, import duties. I remember that the convener mentioned import duties on medical equipment. And import duties are currently being removed from selected equipment. And this is aimed at ensuring that these things come in at a reasonable cost into the country. Public-private partnerships to enhance access to quality and affordable care locally is also being enhanced. Improvement of quality assurance and accreditation. We have said that Nigerian hospitals do not have international accreditations, and the federal government is working on this to make sure that these Nigerian hospitals are upgraded to meet international standards, which will give confidence to foreign clients and the diaspora population. Efforts are underway to create platforms to showcase the vast services provided in our hospitals. You know, we talk about medical tourism, but the truth is that even the Nigerians do not know the services provided in Nigeria. And so that is one of the reasons why, they go on this medical tourism, because they don't even know what we provide. So some of the barriers against making Nigerians to move out of the country for tourism, for medical tourism, are infrastructural and skill deficits, quality and standards, visa and travel constraints, awareness and marketing, as well as brain drain. So to bridge these gaps, we need to have government and private sector to collaborate to build and operate world-class facilities. Health and tourism ministries must align policies to create a unified ecosystem, and regional cooperation among African nations to have medical hubs in different countries so that we don't end up duplicating and expanding choices. And then diaspora engagement can attract patients who seek care in familiar cultural environments while reconnecting with their roots. Ladies and gentlemen, medical and wellness tourism is more than an industry. It is a bridge between continents, between traditions and modernity, between care and commerce, between wellness and prosperity. If we seize this opportunity, Nigeria can emerge not just as a consumer, but as a global leader in medical and wellness tourism, providing quality care, creating jobs, boosting our economies, and most importantly, bridging the health gaps that divide humanity. I urge us to commit ourselves to this vision, that Nigeria becomes a destination not of disease, but of healing, not of deficits, but of excellence, not of flight, but of attraction. The Federal Ministry of Health is committed to building a robust, inclusive, and globally competitive health and wellness ecosystem. Together, let us build bridges that will make wellness and medical care accessible, equitable, and sustainable for all. Thank you for your attention, and I wish you fruitful engagement at this expo. God bless you, and God bless the Federal Republic of Nigeria. And on behalf of the Honorable Minister of State for Health, Dr. Isiaq Salako, I declare this conference and exhibition open. Thank you.